In a world where modern medicine offers solutions to many ailments, it's easy to forget the bizarre and often mind-boggling treatments that our ancestors relied on, believing in their power to heal the most perplexing of conditions.
Welcome to Path to Facts, where mysteries are solved and wonders are revealed. Today we'll delve into a world that's right under our noses, yet still full of surprises.
1. Trepanation. One of the earliest forms of surgery known to man, trepanation involved the deliberate drilling or scraping of holes into the skull. Ancient practitioners believed that this radical procedure could relieve conditions related to intracranial pressure, release trapped spirits causing mental disturbances, or repair traumatic brain injuries. Evidence of trepanation has been found in various ancient civilizations, from Neolithic Europe to pre-Columbian Peru, suggesting a widespread belief in its efficacy. The rationale for this method was rooted in a fundamental misunderstanding of human physiology and the nature of disease. Despite its horrific nature by today's standards, it intriguingly demonstrates early man's attempts to directly intervene in what they perceived as life-threatening health problems through surgical means, albeit with a drastically different approach to risk and hygiene than modern neurosurgery. 2. Bloodletting. For centuries, the practice of bloodletting was a cornerstone of medical treatment in many cultures, including the Greeks, Egyptians, and Mesopotamians. The process involved the controlled removal of blood from a patient with the goal of curing or preventing illness and disease. Ancient physicians believed that an imbalance between the four humors, blood, phlegm, black bile, and yellow bile, was at the root of disease, and that bloodletting could restore this balance. Methods varied from the use of leeches to the cutting of veins, and the practice continued into the late 19th century. Despite its widespread acceptance, bloodletting often weakened patients and in many cases proved fatal, providing a stark example of the dangers of medical dogma unsupported by empirical evidence. Surgery to relieve venous congestion, proving that some ancient PE. 3. Leech Therapy. Leech therapy, or hydrotherapy, involves the application of leeches to the skin to draw blood, which is believed to remove toxins and balance bodily fluids. The practice dates back to ancient Egypt and was widely used in medieval Europe. The leech's saliva contains anticoagulants and substances that promote blood flow, which led to its use in treating everything from headaches to gout. While the idea of using leeches may seem repulsive today, the practice underscores ancient civilizations' attempts to engage with the natural world for healing purposes. Interestingly, modern medicine has found legitimate uses for leeches, particularly in microsurgery and reattachment surgery, to relieve venous congestion, proving that some ancient practices have scientific value. 4. Mummy powder. The use of mummy powder as a medical treatment during the Renaissance in Europe is a fascinating example of the intersection of medicine, alchemy, and the macabre. Europeans ground mummified remains, believed to have mystical healing properties, to create powders used to treat a variety of ailments, from wounds to stomach problems. The practice stemmed from a complex mix of respect for the medical knowledge of the ancient Egyptians, a fascination with death and preservation, and the medical philosophizing of the time, which often mixed scientific inquiry with magical thinking. The trade in mummy parts reflects not only the era's medical practices, but also its attitudes toward death, the body, and the past, making it a curious chapter in the history of medical treatment. 5. Mercury Treatments. The use of mercury in medicine is a testament to the ancient quest for healing substances, despite its toxic properties. Mercury has been used for its supposed therapeutic benefits, from the Chinese belief that it could grant eternal life to its use as a common remedy for syphilis in Europe until the early 20th century. This heavy metal was used in various forms, including ointments and ingestible compounds, based on the theory that its unique properties could counteract disease. However, the toxic effects of mercury often exacerbated patients' conditions, resulting in severe mercury poisoning. The persistence of mercury use across cultures underscores the historical challenge of distinguishing between beneficial and harmful substances without a clear scientific understanding of their effects. 6. Animal dung ointments. The ancient Egyptian practice of using animal dung in medical treatments reveals a complex understanding of materials believed to have healing properties. Mixtures of dung from different animals, believed to have different therapeutic effects, were applied to wounds or used in other treatments to fight infection. While the idea of applying dung to an open wound seems counterintuitive today, given the risk of introducing infection, it reflects an early form of biomedical experimentation. These practices were based on observations of natural substances and their effects, albeit without the benefit of modern germ theory. This approach to medicine underscores the resourcefulness and ingenuity of ancient healers in their quest to understand and combat disease. 7. Urine therapy, the ancient Roman practice of using urine for various medical purposes, including dental hygiene and wound treatment, illustrates the innovative, if often misguided, approaches to medicine and personal care in antiquity. Urine, particularly because of its ammonia content, was valued for its supposed antiseptic properties and used in a variety of medical and cosmetic contexts. This practice reflects the practical approach of the Romans to health and hygiene, using available resources to address common health problems. However, the effectiveness of such treatments is questionable by modern standards, and this practice provides insight into the limitations of ancient medical knowledge and the lengths to which societies would go to find treatments for ailments. 8. Cauterization with hot irons. The ancient practice of cauterization, the use of hot irons to seal wounds or create counter-irritation, was based on the theory that intense heat could not only stop bleeding, but also draw impurities and disease from the body. This brutal method of treatment was used in various cultures, including battlefield medicine, to prevent wounds from becoming infected. The pain and risk associated with cauterization were considered acceptable in the context of its perceived benefits, underscoring the drastic measures physicians were willing to take in the absence of effective antiseptics and antibiotics. While cauterization is still used in certain medical procedures today, the ancient practice was far less precise and more dangerous, often leading to further complications. 9. Sweat baths. The use of sweat baths by ancient cultures, such as the Mayans and Romans, as a method of cleansing the body and treating disease, highlights a holistic approach to health that integrates physical, spiritual, and community well-being. These baths were believed to facilitate detoxification by inducing sweating, thereby ridding the body of impurities. The communal aspect of these practices also played an important role, serving as a social and spiritual gathering place that strengthened community bonds and shared cultural practices. This ancient method of healing underscores the importance of environmental and social factors in health and wellness, a concept that resonates with some modern approaches to health that emphasize the importance of lifestyle and community and wellness. 10. Cannibal Cures. The Renaissance practice of incorporating human remains into medical treatments reflects a complex interplay of medicinal, cultural, and spiritual beliefs. Medicines made from human bone, blood, or fat were believed to contain the essence of life force and were used to treat a variety of ailments. This practice, rooted in the belief that the material of the body could be reused for healing, highlights the historical fascination with the body and its potential to cure disease. The use of human remains in medicine also raises ethical questions about respect for the dead and the limits of medical experimentation. Despite its morbid nature, this practice provides insight into the evolving understanding of medicine and the body and the lengths to which humans have gone in their quest for health and longevity. If you enjoyed this journey into the peculiar corners of ancient medicine, don't forget to like, subscribe, comment, and share to delve deeper into history's mysteries together.